Welcome back, everyone. The Vitality Check podcast. I'm your host today, Kevin Lumper, with one of my good buddies, business partner, and much more.
Appreciate
Jason,
that.
I almost called you Dr. Jason Turtle.
Wow.
We could.
Thank you. Yeah.
Sean's not here. We could call you anything, I
Yeah,
guess.
exactly.
Nice. So, how you doing?
I'm good. I'm good. We're high off a big victory last night for
Ah,
round one of the playoffs. The Habs
yeah.
made it very interesting. Bit of a nail biter, but hey.
Yeah, for those of you that are not from Montreal or do not listen to hockey at all, it is the Canadians actually won the first round and are moving on. So this is very exciting. It's been so long. And
Yep.
yeah, so that's it. Yeah, it was extremely stressful. Crazy.
They got it done, but it was not pretty.
Like the
Not
point
pretty at
where my
all.
kids think I have psychological
Yeah,
problems,
yeah.
stressing watching hockey, like, which they're probably right.
I'm a little superstitious, so I was watching with my oldest son, and a couple of times when the clock stopped, it stopped at like 12:12 once. I'm like, well, really, this 12 is my favorite number. That's like a sign. And
Double
it stopped with
12.
like 6:12 to go. I was like, this is good. These are good omens.
Yeah.
I was just trying to do that to make myself feel better,
Nice.
but yeah, it was great. So yeah, otherwise I'm great. Looking forward to some golf coming up.
Mm.
I think they're supposed to get sunlight in Montreal at some point, right? Some sort of
I
game.
think so. I think so. Yeah.
But
I know
yeah,
it's been kind of cold and it's been wet. Yeah, what is going on?
yeah,
Anyway,
not good.
what are you
You?
gonna do? It's gonna get nice eventually,
It has to.
right?
Calendar says it has to.
Just check that farmer's almanac.
Someone told me that last
Oh,
week, but it
bang on.
wasn't that amazing.
Oh yeah, they're starting to
Things,
lose their.
well, no, it's in the
Didn't look
temperatures for the
good.
summer. Yeah, they said it was gonna be hot,
I heard that.
but some rain too.
Mm.
Mm.
Hot rain.
Hot rain.
Hmm. All right. Well, if we jump into our topic today, we basically we're chatting about
Sean,
what
most of it, Sean,
mostly about Sean.
and his absences and his, lack of discipline is really what we should be talking about.
Yeah, it is a bit shocking. Well, not really. No. Yes and no. But I think it's for good intention,
Sure.
right?
Yeah. He's thinking of other people.
But like there are other days of the week, like
I
so.
know there's other people, but it's not about us. He's a little selfish.
It's a bit selfish. We call him out while he's not here. Yeah, for sure, for sure. We'll put an asterisk beside his name.
Yeah.
Yeah,
Occasional guest.
yeah. Vitality Check podcast starring Kevin Lockbray, Jason Turnbull, and sometimes
Yeah, perfect.
Sean Lowry.
Little disclaimer.
I'm not calling him doctor. I won't do it.
Yeah, asterisk is good.
Yeah. Anyway, so back to the topic. So today we thought it'd be important to discuss when is it crucial to see a doctor, right?
Yeah.
Because a lot of people come in to see us, and they'll, like you said before, when we're off air, a lot of people have said that to me too, is where, well, when something's wrong, I just call you guys.
Yeah.
Which, like probably most often, certain things that are happening to people are things that can be managed through
Yeah.
some of the services here at the clinic. Although there are ones that for sure all our therapists here are trained to recognize these red flags that potentially would warrant you to see your physician
Mm-hmm. Or the emergency department. Yeah.
or the emergency room. And we've had examples that we can give today.
Yeah.
One that comes to mind is thrombosis.
I had one.
You had one. I had one years ago. So
three, believe it or not.
yeah,
Yeah, but 1 2 weeks ago. Yeah, absolutely. Anyway,
so go ahead.
Yeah, well, I mean,
Well, why don't we jump into that? Like, because basically, there are. Do you want to list like some of the major red flags first, and then we'll start giving
Yeah.
examples of it?
Yeah.
Okay.
I think too, like when people say this, they say the same thing to me too. We come here first just to make sure I know you'll send me in case something's wrong. I chuckle. I'm like, well, thank you for your confidence, but
Yeah.
we are not diagnostic machines. We are able to recognize some red flags. Obviously, that's part of our training. But I always laugh. I'm like, okay, well, thank you. So let's just put our goggles on and look extremely closely. But yeah, there's a few things that we're trying to kind of wrap our head around and has to make sense, right? Doesn't matter if you're an osteopath or a chiropractor or a physio, everyone's working within their scope. So you're always trying to say, is this actually an osteopathic issue? Or is this something that can't be, handled on site?
Sure.
Yeah. Well, first thing that comes to mind for people is like when they come in, they're having something new, right? That's not going away. Um, people talk about sometimes a pain of like an unknown origin, where
Right.
it started, they don't really know, there's no reason to why it started. It's moving around everywhere, and it usually has other systemic signs with it, but it's just
Yeah.
doesn't feel right. Generally it has to make sense. I always say that to people when we're assessing the first time, it has to make sense. Our bodies are like a map. They essentially tell us where to go.
Right.
And when things don't add up, then that kind of gets us to be a little more,
Yeah.
you know, step back. Let's ask as many questions as we need to make sure that everything lines up. So the pain that's moving around everywhere, like in your that instance of the DVT, like in someone's leg, it's in the front of my leg, the side of my leg, my back of my leg, it wakes me up during the night.
Yeah.
Pain at night
Pain
only
at night.
is a
Yeah.
big one too. No pain during the day at all, pain at night.
Yeah.
Boom, another kind of red flag that pops up, right?
Yeah.
You following?
Yeah, no, or you see certain things where people have symptoms and the frequency starts to take a take a jump, like
Okay.
so they start to have like certain discomfort. You should think of that with abdominal pain and things like that too. Sometimes like, oh, it's something that I've felt before, but now it's just happening all the time. Things like that are kind of red flags to get looked at for sure. Especially if, for instance, we're treating something and we're noticing it's not really changing.
Yeah.
So that again is knowing on our part, like okay, this is something that we really want to get looked at just to see like what is preventing the system from
Integrating the
fixing
changes
itself
yeah.
and actually progressing here. There must be something in there. And I'm sure this happened to you a ton of times. It happens with quite often with fibroids, abdominal fibroids, or anything non cyst or things like that in the abdomen, to occlusions and things like that, but which are people suffering from usually constipation and this type of dysfunction. So those types of things for sure would be weren't getting looked at. I've had I remember a patient coming in saying they hadn't gone to the bathroom in 20 days. Like, that's concerning,
That's a little long.
So
Seriously, that's crazy.
So there's, and nothing's working. Okay, yeah, I think we need to get some emergency help here.
Yeah.
So, yeah, that can be it. Like you said, the nighttime pain for sure.
Yeah.
There's one big one is drastic weight loss.
Yes.
So drastic weight loss, sometimes weight gain.
Yeah. Usually weight loss, but sometimes weight gain. Yeah. You're talking like 10% of body weight in a couple of weeks kind of thing. It's pretty drastic usually.
Like quick, yeah.
Yeah. I say significant headaches that don't relieve, right? You can't get relief from anything. And it makes you think, intracranial pressures and stuff. You definitely want to get that investigated. For sure, that's big.
One big one that we'll see often, like people come in and just to distinct between the two, like chest pain. Okay, so the difference between, let's say, cardiac type chest pain versus like rib displaced chest pain. So people come in and say, "Oh, I have a spot here. It's just there's so much pain there. I think I'm gonna go get checked to see, make sure it's not my heart." Like obviously if someone's that concerned,
you send them anyway.
Just go do it.
Yeah, of course.
There's nothing wrong with just getting checked, obviously.
Yeah.
But quite often when it's specific and small area like that, it is actually a rib that's misplaced or something of that nature. Whereas large dispersed discomfort in the chest pressure is, something quite different.
Like something heavy crushing your chest.
Yeah, exactly.
Again, usually has other symptoms, right?
Left arm numbing, jaw pain in women.
Denial.
Yeah.
Well, sweating, like systemic things too, right?
So we had something like this happen actually at hockey. Our hockey league, one of the goalies had I get called on the ice, and there's a physician on one of the teams that came out to help as well at the end when we got him off the ice. And this guy near the end of the game was just saying, I go, "What's wrong?" And he said, "Well, I've had chest pain for a good 15 minutes now." And I'm like, "Okay, where do you feel it?" He's like, "All here," because it's so tight. It keeps tightening and tightening. I'm like, "Okay, let's call 911." Call 911. He goes, "My arms are numb also." So we pull him off, make sure we find the AED. And thankfully we were able to calm him down and stay with him while the ambulance showed up. And he crashed twice in the ambulance. Like, so these are, and when you talk to him now, he says, he goes, I had signs like this that were smaller for weeks.
Yeah,
So he had a major blockage.
of course.
Had to have a stent put in.
Yeah.
So imagine like this. That's like the scariest thing is going to like a sporting event for, you know, old timers.
Hmm.
And basically, someone's not taking care of themselves and they just go out once a week and skate around like a maniac.
Or they have some genetic makeup for it too,
Sure.
right? In the family, I used to play with a guy who on my team, he was probably early 50s, maybe early mid 50s. Like worked as like a contractor, like, he did like physical labor. I would argue of all the guys on my team, he probably looked like he's in the most shape for
Yeah.
the most. And yeah, after one of our games one night, he went home, wasn't feeling well, and woke his wife up at like 2 in the morning and said, "I gotta go to the hospital." And he had some stents put in right away the next
Oh,
day,
wow.
and he just knew something was wrong. But yeah, it's hard. It's really, like you said, it's scary. It's also, it makes me laugh because I'll sometimes remember, I'm sure you've had the exact same discussion, but you go to play hockey and, are certainly not getting any younger.
Right.
And, someone in your team will say, this is so good. I love being here. And, I do this every week to stay in shape. And I'm
Right.
like, oof. I said, I think you got to look at that a little differently.
You
Because what do you
might.
mean? I'm like, well, I think you need to be doing a lot of things during the week so that you can do this, to
Yeah.
be in enough shape to do this once in a week. Because for anyone who plays hockey, they understand how demanding it is when you're on the ice. Your heart rate just goes crazy.
Yeah.
I'm sure you've wore a heart rate monitor or a watch once that show you like it is peaks and valleys, like on the
Yeah.
ice, off the ice, on the ice, off the ice.
I should do that. I've never done that actually.
Oh, that's incredible.
Yeah.
It's pretty cool to show your recovery.
Sure.
It's very clear to know when you're
I
on
go
the
through
ice.
the old fashioned, like, what do I feel like?
Oh yeah,
I always
that's
feel pretty good, but then, I could, yeah, obviously we do other activity too to stay in shape though, but yeah, you're right. It's dangerous when that's your one source of energy and it's just like full on psychosis to like sitting on a bench and
that's
then
like
full
Russian
on.
roulette right there.
Yeah. Yeah, you're testing the limits for sure.
Absolutely. Yeah, that's for sure.
Um, yeah, so there's been a couple good events over the years, like you said, the catching the thrombosis with the
Hmm.
person's leg. I've definitely had that one. There was one also with an aggressive cancer.
Hmm.
Someone had thyroid cancer. Well, I didn't know this, but coming in for shoulder pain. And so again, that was on our part just to be, alert and vigilant to like, okay, what doesn't seem right here? It doesn't make any sense. Like the person's pain in their shoulder was that full range of motion and everything hurt like in every direction, like you're like,
Yep.
okay, wait a second. That doesn't make sense. Either his spleen has a problem because of the left shoulder.
Hmm.
And then, but it was just initially on the observation of like, have you noticed that you're puffy like in the, in your neck?
Hmm.
Oh no, I didn't notice that. So I'm like, either this person's blind or this, because it was significant.
Okay.
And you could tell like this guy was in shape. It's not like sometimes if let's say you're a little bit overweight, you
Yeah,
might
you can
not
tell.
notice
Yeah,
it.
of course,
You
of
might not
course.
notice it. But and then when he looked, he's like, my God. Because I swear to God that,
I wasn't there a couple days ago.
that was not like that.
Wow.
So I, without trying to make them panic, we were saying, listen, this can happen where people get nodules on there.
For sure.
It happens all the time.
Yeah.
I would just on the side of caution go get checked. He was in surgery 2 days later, and he still texts every year on the anniversary. It's been 10 years,
That's awesome.
and he full recovery, doing well. But so that would be one of the things. It's just be very observant and, like you said, trust. Like when you feel that something isn't right,
Yeah.
you gotta go get
Well,
checked out.
that's why I said the heart with denial. That is a strong thing that they talk about. Is when people, no, I'm okay, but they kind of bury it down there denying it. That's a very, especially guys for heart attacks, that's a very big one because they don't think it's that they're invincible, right? I can't be that, I can't be that. But then they're sweating, like
Yeah.
it's tough. Yeah, I've had a few. I remember when I was working in Ontario, I had a guy come in for a post knee meniscectomy.
Yeah.
And he couldn't stop talking about his back. So I looked at his back and he had a big, like, obvious swelling right on his spine. And he was gone 3 months later. He had bone cancer.
No.
Yeah. So just taking the time to look, he wasn't there for that to see because I was an AT back then.
Yeah.
Yeah, it's so obviously that's a warning for people, right? swelling heat, a lot of heat around a certain area,
Yeah.
things like that. I had someone in too in the fall. I've known her for 12 years, let's say. Right. Pelvic pain, digestion, some neck stuff over the years, and yeah, had my hand on her midsection, like fired small intestine, took my hand off, put it back on. I kind of looked at her and I'm like, "What's this? Oh, you can feel it?" I'm like, yeah. She goes, "I was waiting to see if you notice." I'm like, what? What?
Nice.
I've been waiting, and I'm like, yeah, you have. I thought it was a fibroid on her uterus because it was large. I felt like it was large, and it was funny, weird. She went to the doctor, had a test done, didn't show anything. I'm like, I think you need to go back. And then I guess they thought it was her bladder. Like, well, empty your bladder. She's, I just emptied my bladder. So she's going to get discharged again. So they're doing an ultrasound. I'm like, well, it looks like your bladder is full. And so she went, and the technician said, well, that's not normal. So they brought the doctor back in. And she finally said, I think, like, can someone just touch there? Because there's, and they, the doctor put his hand in her head and was like, wow, like, you need an immediate like CT scan. Like, there's something there. So she had a 10 or 11 centimeter cyst on her uterus.
Oh,
Yeah.
wow.
So stuff like that. She kind of knew. It started a little slowly, but it's anything. If you feel growth, if you feel heat, that's the kind of stuff that you have to, especially if it comes for a day or there's a reason because you sprained something that's different. But if it just comes out of the blue and it's
Yeah.
persists,
Yeah, for sure.
absolutely that has to be investigated.
Yeah.
100%. Yeah.
Yeah, like we do here at the clinic. What I find interesting is like when people do that process and they go see their doctor, regardless too, we try and actually explain, well, why did that happen in the first place? So there's like causation of disease too, and people, it's not everyone. Let's say that would be totally open to that, which is totally fine, which I get because it's not something we learn. It's not something that we are taught as growing up on like our views, our perception of things having an impact on the biology of the body.
Of course.
But we like to take time to actually explain that to people to make sure that even though they have an intervention done in the medical field, that, okay, it's also important that you understand, well, where did that come from? Why is that happening? So like,
is there anything that you could possibly do to understand why it occurred, or importantly, not to have it reoccur?
Correct.
Lifestyle modifications or whatever.
So on the thyroid note, so they're this is a common one that people have nodules there or even cancer there. And I had a patient recently that happened to that had the operation and had it removed, which is fine, so we're obviously working on the scar and working on her neck pain and things like that. And then she was curious, I don't understand where this came from. So then I said, well, the explanation in terms of like German new medicine is has a lot to do with someone that feels like they don't ever have enough time. But they're always chasing, always, oh my God, I better get this done. I'm running out of time. So it's like, and she goes, my God, you just described my life. She goes, constantly chasing.
Wow, that's
so cool. She goes, what do we do with that? I said, well, the idea is like, well, why are you doing that? Well,
now you're aware.
Why do you feel the need to do that? So like, and the more you can work on that and just knowing that, okay, I just do the best I can and whatever doesn't get done is totally fine. So there's a lot more to it than that, but her solutioning and knowing like, oh, okay, so I can actually have an impact on this and not make sure I don't get sick again. It's pretty cool.
For sure.
So
think how many people live just like that. And
sure.
How many people you see on Synthroid for hypothyroidism or whatever.
Yeah, for sure. So like, that doesn't take away from the having the intervention that you need, to having treatment that you need.
No, of course,
like, all this is.
No, but if you can learn from the other aspects, saying, "Wow, I guess I never went," because if you just theoretically, she never modified her behaviors and lifestyle.
Correct.
Maybe her outcome, the recovery is not quite as well as it could have been. Right. Yeah, that's well, it's funny you say that because how many people over the years have you heard talking about work? When it's really busy, if they're in a busy industry, and they'll say just that. They're like, I've come to the realization that no matter how hard I work and no matter how many hours I put in a day, I'll never catch up. So I've just had to learn to realize like I can just do the best I can.
Yeah.
Which is great, right? Which is true. So that's really important. Nice. So what else are we missing here for red flags or emergency stuff? Well, systemic stuff, I think we covered that, like fever, like fever, so you're never going
Blood,
here for a fever, blood. Yeah, so blood in your stools, blood in your
urine.
urine. Yeah.
Yeah,
You can have old blood in stools, you can have a new blood, right?
yeah,
Frank red blood is usually more of a superficial or cut or something.
yeah,
Old blood that's more in your colon is probably black. You definitely want to get that looked at.
yeah.
You shouldn't really see blood in your urine either.
No,
Oftentimes there's blood in your urine, you can't see it. It just
correct.
comes back on a urine test.
But if you can,
That's a problem.
that's the problem.
Yeah.
Um, yeah. So then again, like that had happened to me. I remember that, and I had gone and they couldn't explain it. And so yeah, but again, it's
But you go
important to go check.
100%.
Yeah, I think that it gives a good summary to people to number one, take the takeaways are like trust your instinct.
Trust your gut.
Trust your gut. You feel something's wrong and it's not normal and it's not going away. You might want to investigate that. Two, you're seeing someone and they're confirming that for you. Well, that's a second kick in the bum to kind of get things looked at for sure.
Well, and the guy you said at hockey that had symptoms for a few weeks, if you actually reflect and take the time, it's very rare there's just one time.
Yeah.
We have some warning shots for sure.
Women tend to be a little smarter with that.
Yeah.
It's funny how the men kind of shy away from it. It's almost like a shot at their virility or something that
Yeah.
So it's just realize like it's important for you to kind of be up on that to get things checked out to make sure that you can take the measures you need to actually feel better and be
Well, it's better safe than sorry. I mean,
Yeah,
I
of
don't
course.
think there's many conditions that the early detection doesn't help, right?
That's it.
The earlier the better for all of that stuff, for sure.
Yeah.
For sure. Maybe that's where Sean
He
maybe he just didn't want to say it.
didn't want to say it. He's getting checked right now.
Mhm.
We could guess. Yeah. No, we'll save that for another episode.
That's the intro.
Yeah, yeah, exactly. We'll do the next intro on Sean and what his test revealed.
Yeah.
Yeah, it's gonna be great. All right, everyone. Thanks for tuning in. Hopefully this helped you out. Obviously, as always, if you have any questions, you can reach out to us at Vitality Multitherapy for sure. We'd love to help you out, and we will talk to you soon. Until the next episode.
See you next time.
Ciao.